afternoon, everyone, and welcome to the CAQH Core Town Hall. This is our second Town Hall of 2018. My name is Erin Weber, and I am the CAQH Core Director, along with Bob Bowman. We have a big crowd today with us, and so for those of you that are new to Core webinars, I'd like to welcome you. I just want to cover a few logistical items before we get started. You will be able to download a copy of today's presentation from the caqh.org website tomorrow. Also, a copy of the slides and the webinar recording will be emailed to you directly in the next day or so. We will save time at the end of today's program to respond to your questions. You can submit your questions at any time, though, during the webinar by typing them into the questions panel on your dashboard. We have a lot to cover during this town hall. We will start off today with a CAQH Core overview, just to level set for those that are new. We will then give an overview on what's going on in the industry, followed by some updates on our latest voluntary work, including value-based payments, prior authorization, and attachments. And then we will round out our presentation with updates on our mandated work, including our core certification program and the phase 3 core maintenance activities for the code combinations. So let's get started. I'm going to introduce our first speaker, my CAQH Core Co-Director, Bob Bowman. Bob?
Great, thanks, Erin. And as Erin mentioned, we do want to provide a quick update on who we are and what we are, give you an overview of CAQH Core, because we do anticipate a lot of new attendees for this session. So on the next slide, you'll find that CAQH Core really is a mission and vision-driven organization. We focus really much exclusively on the creation and adoption of specific operating rules based on standards through in ensuring that we do that through the facilitation of the industry. We look at the industry, where it's going, what it's doing, and where and how is the best way to get there next. And we do that really through our integrated model. We do a lot of research and development and sounding out of potential opportunities. We look at how we can design and test certification around those types of opportunities and operating rules. We promote adoption, we track progress and ROI, we maintain and update those rules. So using that facilitation component with the industry, we really do focus on very specific needs that the industry has. On the next slide, you'll see that there are very specific numbers we want you to take away from us today, and that is we have over 130 core participating organizations that all sit at our roundtable and talk about and work towards the goal of making things easier to do for that interaction between providers and health plans. There are 4 phases of core operating rules that have been published and marketed in part of the industry that we're all part of today, 3 of which are federally mandated operating rules. And this specific designation is that if you are a HIPAA-covered entity and you're conducting a HIPAA transaction, you must also conduct that transaction using the CAQH Core operating rules. Something that you'll hear a little bit about later is also our core certification program. And to date, we've issued 340 core certification seals to entities that have gone through a voluntary testing process to ensure that their systems and applications are in compliance and in conformance with those core operating rules. So it's a great goal to achieve for many of these organizations. It's also great for us because we're able to prove that their systems are in conformance and compliance. On the next slide, you'll see that the operating rules really are crucial in the way that we conduct our business, because remember the intent of the operating rules, although they're founded and based on very specific standards, the operating rules are those business interactions that take place. So we're trying to turn those provider interactions that are manual, like every time a provider has to pick up a telephone or send a fax or do data entry on a web portal, that we're trying to turn those transactions, trying to turn those interactions actually into electronic automated transactions so that the provider and the health plan both have savings. There's these efficiencies. And so these are kind of some of the benefits for each of the phases you see here. Improve the revenue cycle management, reduce claim denials, ensure that the provider has the data that they need to conduct the next level of interaction, either with the member or with another health plan. We've done this by looking at specific HIPAA transactions, like the eligibility transaction and claim status for phase 1 and 2, or the EFT, the electronic funds transaction, the healthcare payment and remittance device transaction for phase 3. And in phase 4, we actually tackled claims and encounters, referrals, certification authorizations, as well as enrollment, disenrollment of health plan, and premium payments. So we're looking at the entire kind of matrix of HIPAA transactions that are available, and how can operating rules ensure that providers adopt those transactions and can automate their systems and processes to have all of the benefits of that automation. On slide 8, we do want to provide a warm welcome to 2 new core board members. The first is Chris Sibes, the Chief Technology Officer and co-founder of InstaMed, and Madhusudan Anadata, the Director of the Division of National Standards, the Centers for Medicare and Medicaid Services. Both are new to the board, and they'll be helping the rest of our current board members work towards our goal of ensuring adoption of the operating rules and the development of the next set of operating rules. I'd also like to welcome 4 new core participating organizations: MDX Health, Tata Consultancy Services, Tetsy Clearinghouse, and TransUnion. We look forward to working with them as well on the development of the next set of operating rules. On the next slide, we'd like to move into really our first major part of our agenda today, and that is to provide you with a couple of key industry updates. Moving on to slide 10, and provide an update on the National Committee on Vital and Health Statistics. Now, this committee is actually meeting next week in Washington, D.C., and we have actually provided a link to the agenda if you have more interest in attending either through the phone or attending in person the meetings that they have next week. But NCHS is working on a predictability roadmap, and the goal of the roadmap is to have a predictable schedule for the industry for updates to the HIPAA standards and to the operating rules. The objectives, as you see here, is to really have a developmental process that can be predicted, that we can have very specific governance around the adoption of standards. We can have data harmonization and cohesion throughout the industry, so we don't have all these silos around the place. And also to make sure that anything that is published, that it is regular, it's on schedule, and there's a timetable. We can actually predict the future because we're going to know the future. So this is going to be an important agenda, an important meeting next week. Part of the agenda also is a Chief Information Officer Forum, the CIO Forum, that's also taking place next week. This is to solicit input from a diverse group of CIOs within our industry to ensure that they have a say and an input, and we understand exactly what their preferences are and where they're directing their resources and time and staff as they move forward and think about the future for health care and health insurance and how we as an industry are adapting to the technology. So it'll be another, again, a key agenda, and we've included a link for that for you as well if you're interested in seeing what those agenda topics are. On the next slide, moving into the HHS HIPAA Administrative Simplification Optimization Project. CMS announced that they are pursuing a proactive compliance review for health plans and clearinghouses. And the compliance is all around the administrative simplification transaction standards, so the HIPAA transactions and standards. The first step is really to involve the volunteer organizations. So CMS has asked for volunteers to be part of their pilot program. It does include health plans and clearinghouses who will undergo transaction reviews of compliance. And we also included the link for you here if you're interested in either volunteering or learning more about the pilot program. But basically, volunteers will submit transactions for testing, and HHS will attest for the kind of compliance to the data as well as to the compliance for the operating rules. There's an attestation component for the operating rules. If there are any issues that are identified, HHS will inform the pilot volunteer what those issues are. There's a way to resolve those issues. There's a way to ensure that there's a remediation process. And then volunteers that achieve successful reviews will have a dated certificate from HHS stating that they have passed that compliance-based review. So again, similar to the core certification the voluntary core certification process, where an entity is reviewing the data as well as attesting for the operating roles. There's a way for CMS now to allow for entities to volunteer and do that, again, on a volunteer basis. With that, I'll hand the call back over to Aaron for our next agenda topic. Aaron?
Thanks, Bob. Bob just covered some really critical efforts that are occurring at the federal level that impact the work we do on a regular basis. We're now going to spend the remainder of the presentation talking about the work that the core participating organizations that are doing within the confines of core. We have a couple different work streams going on right now. The first that I'm going to talk about is our value-based payments work effort. And we also have rule development going on a voluntary basis around prior authorization, doing some preliminary research on attachments, as well as the ongoing maintenance that I mentioned earlier. We began our value-based payments work back in 2015, and interestingly enough, this data point on the slide here demonstrates that right around that time we were really starting to see an increased use of value-based payment models across the industry. The core board recognized that this was a change that was coming, and as they were implementing value-based payment models at their own organizations, they realized they were experiencing some of the challenges that they had initially with the original HIPAA administrative transactions implementation back in the early 2000s. You can see here that the transition to value-based payments has not been without its challenges within the industry. And this is just one survey with a couple examples of where healthcare executives are reporting barriers to success with value-based payment models. There's a cost to implement and develop the infrastructure around the models. Staffing is a challenge, interoperability between organizations, and the relationships between organizations have to change as well with these new models. So as I mentioned, the core board was seeing some of the same challenges of implementation occurring on the operational side of the value-based payments models as in the past with the fee-for-service issues. Specifically, some of the operational components behind how a provider and a plan interact and exchange data are varied between the different models. There are proprietary approaches being used and workarounds to make the fee-for-service processes work for the value-based payments, but it's not ideal, and it's causing some barriers and burdens on the industry. The CAQH board saw this challenge and recognized that there might be a role for CAQH to play. We have been bringing stakeholders together for many years to address operational challenges on the fee-for-service side of healthcare. There is an opportunity here as well for the industry to come together and agree on some common approaches to value-based payment systems as well. So we've spent a good deal of the past 2 years conducting research, including interviews with key stakeholders, surveying the core participating organizations, reviewing what the industry was doing already in these spaces, and found that there really is a need for industry collaboration to minimize these variations in the industry with regard to value-based payments. And we identified some opportunities areas where if they were addressed or there was some more uniformity across the industry, the implementation of value-based payments would be smoother for the industry. So we put out a report at the beginning of March outlining the 5 broad opportunity areas that came out of the research. And then within that report, there's some very specific recommendations and strategies for the industry to consider to address some of these challenges. We are not naive enough at CORE to think that CORE alone can solve these issues. These are big topics and big issues. And so actually in the report, we call out some candidate organizations and stakeholder types who either already are or have the potential to be leaders in this space to successfully propel VBP operations forward. Specifically, our vision is to create a common foundation that drives the adoption of evolving value-based payment models by reducing operational burden, improving information exchange, and enhancing transparency without necessarily compromising the competitive value of the various models out there in the industry. I mentioned there were 5 opportunity areas that came up in the research. They're outlined on the slide here. The first is data quality and standardization, and I think this one kind of permeates all of the issues as we go through them. But there are different data needs within value-based payments, and there are different ways in which data is being used. And you know, a good example is terminology. In some models, terminology may mean one thing. For example, an admission. Is it an inpatient admission, an emergency department admission? Coming to some common agreements around that language would be really beneficial for the industry moving forward. The second opportunity area is interoperability, and we focus specifically here both on technical interoperability, the ability for systems to exchange information between each other, but also process interoperability, maintaining similar workflows and expectations for infrastructure around data exchange. The third area is patient risk stratification. One of the challenges we heard throughout the research was the lack of transparency around the various models, and therefore making it very difficult for providers to understand how their patients had been stratified. Creating a more uniform approach and sharing information or best practices could really improve this space. The fourth is provider attribution. Again, there are different models out there being used for the various value-based payment models, and this in particular makes it difficult for providers to understand and address the challenges with their various patients who may fall into one category under one model and maybe a lower risk under another model. So again, more transparency and information sharing is needed there. And the fifth is quality measurement, and this is a topic that certainly not one that CORE would address. You know, we know there are many excellent organizations working on this topic already, but it came up so much in the research that we couldn't ignore it. The challenge with quality measurement is threefold, really. There are too many measures, the measures are not meaningful, and it's a burden to collect the measures. And so coming together as an industry and working towards solutions on the quality measurement space was also really critical in the research as well. I'm going to stop here for a quick polling question to understand from you which opportunity area do you think from the research has the greatest potential to improve the operational components of value-based payments at your organization? And I realize these are very broad categories, and well, I hope and encourage you all to read the report in detail. You know, why don't we just get your feedback now quickly on where you think the most value and time should be spent to move the industry forward. I think we can go ahead and close the poll. This has been a consistent response as we have asked this question in several different venues now. You know, data quality and standardization really rises to the top in a meaningful way. I think that is in part because that, as I mentioned earlier, that topic really impacts some of these other topics, but interoperability and quality measurement also being top of mind for many. So next steps in our value-based payment work. We have been conducting an ongoing education series related to value-based payments. Much of what we found in the research was that just greater industry education and awareness on some of these topics is required. So to that point, we have been doing ongoing education. We have been talking to other organizations to both build awareness around the opportunity areas and collaborate and understand better where others are working in these spaces already. We are continuously updating and adding to our detailed research findings to add greater depth to those opportunity areas. And later this year, we plan to launch an advisory group, which would be a small group of about 10 organizations to really help evaluate the opportunity areas and the specific strategies within them against a solid set of criteria for areas in which it is appropriate for CAQH Core to pursue. And that advisory group would then provide guidance to Tiger teams responsible for executing identified deliverables. We see the outcome of this work as potentially operating rules, but it could be much broader than that. Implementation of value-based payment models is still in its early stages. So there may be need, as we said, for more education, more information on leading practices, and just greater understanding and awareness across the industry. To that point, I want to highlight quickly our value-based payments education series. All of these webinars are available on our website to access for free. So if any of these topics are of interest to you, I encourage you to go back and click. We did do an overview of the report and the findings as well with Dr. Sue Turney, who is the CEO of Marshfield Clinic Health Systems. Our next webinar is next month. I can't believe next month is June already. On the role of interoperability and value-based payments. Earlier this month, we heard from Dr. Kate Goodrich at CMS to hear a little bit about what CMS is doing in the interoperability space. So in this next complimentary webinar, we'll hear from Kelly Cronin at ONC more on the work that they're doing with regard to interoperability. So with that, I'm going to turn it over to my colleague, Rachel Goldstein, who is a manager with CAQH Core, to talk more in depth about the work that Core is doing in terms of developing draft operating rules for prior authorization. Rachel?
Thanks, Erin. So I know there are some folks on the line who maybe want a little bit of background on Core's work with prior authorization. So Core sees this vision for prior authorization as really to introduce that targeted and incremental change to propel industry collectively forward to a process that's much more efficient than it is today, and to reduce that burden on providers and health plans, which really leads to more timely delivery of patient care. So phase 4 of the Core operating rules established some critical infrastructure requirements that laid foundation for the exchange of requests and responses. And given a lot of interest from our participating organizations, our board, industry in general, as well as NCVHS, we decided to move forward with additional rules for prior authorization. Industry interest really is at an all-time high, and we continue to see that grow. And the good news is that many of these efforts truly are complementary in nature and are identifying similar barriers and really coming to consensus around what some of the solutions will be. So in addition to Core's prior authorization environmental scan that was conducted by a multi-stakeholder advisory group prior to our current rule development, some other major critical efforts in the industry right now, and these are just some of them, but they really are important to note, are AMA's prior authorization and utilization management reform principles, a recent industry consensus statement on prior authorization, which is authored by several major associations. I'm sure you see all the alphabet letters up there on the left. And it includes plans and providers, which I think is really incredible. And here at CAQH Core, we really support that wholeheartedly. It's at the root of what we do, is that industry cross-stakeholder consensus. And also the WEDI subwork group on prior authorization, which is working diligently to draft a white paper on workflow barriers and guiding principles related to use of the 278 transaction. So, where do core operating rules come into all of this? Well, we truly draw on all of these efforts because they are the voice of industry players, and we use our participating organizations to design implementable and industry-driven solutions to a lot of these barriers that are brought up by many of these organizations, so that we can all work together to make this a better and more user-friendly process. So I did want to provide an update on our subgroup, and I think Erin mentioned this before, but our prior authorization subgroup has about 50 participating organizations that participate with CORE and over 100 individuals, and we're moving forward on drafting potential rules that will then go through the approval process within CAQH CORE and get that industry consensus. But right now, the subgroup is currently developing some detailed requirements for a draft rule, and these draft requirements address issues pertaining to a health plan receiving the information they need to adjudicate a PA request, or to the provider receiving a response back that provides clear direction on next steps to actually get that request approved. So there are kind of two specific issues, I would say, that these draft requirements seek to address in the rule that's being developed. And one is that PA requests submitted via the X12-278 transaction are often pended or denied due to missing or incomplete information. And providers don't always have consistent or clear guidance on when to provide certain information and where on the request it should actually be placed. So this can be confusing and interrupt workflow, as I know many of you on the line are painfully familiar with. So some of the options that the subgroup is considering in the requirements are ways to reduce the amount of errors that are sent back to providers, and ways to make the error be a little bit more specific so that providers can really understand directions they need to take. Another issue is that when providers receive pending and denied responses, the codes are not always clear, and sometimes they're, pretty ambiguous, so there's that manual follow-up. In addition to what I've just described with the rule that's in the draft rule that's in development related to the 278 transaction, the subgroup is also considering potential rule options that would relate to non-278 submission methods. The two areas being considered are requirements for standard use of a minimum data set for proprietary submission methods, as well as infrastructure requirements that include an acknowledgement, confirmation of receipt, and availability requirements for the non-278. So this would really take the Phase 4 infrastructure rule and apply it outside of the 278 as well. So following selection of these rule options, the subgroup will begin to draft more detailed requirements for these additional potential draft rules. Excuse me. Next slide, please. Thank you. So here you see a roadmap, and this is tentative, of course. It's subject to change based on feedback from the participating organizations in the PA subgroup. But this is a timeline and an approach for how we see getting to the approvals of the rule set. So you'll see that where we are here in Q2 of 2018, we're still in that rule development period where the subgroup is developing, refining those rule options, drafting those detailed requirements that will go into the draft rules. And then the rules work group will be convened, and that's also comprised of core participating organizations. And it's a great opportunity for the broader core participating organizations that may not participate in the subgroup or already do to continue or become active in playing a hand in some of this phase of rule development. You'll see that we'll also engage a certification and testing subgroup, which again is made of our core participating organizations, to develop a certification and testing, a test suite that will go hand in hand with the rule set to help implement those rules and test the implementation of them. Once that's finished, all core participating organizations will then vote on the rules, and then there will be voting and approvals by the CAQH core board. So we're looking at some great work over the next few months, I would say. I think it's a really exciting time. There are a lot of opportunities to get involved. I know this is a topic and an issue that really hits home with many of you, and I would definitely invite you to join the effort and to reach out to us. Thank you. I'm going to go ahead and pass it to Taha to talk about our work on attachments.
Thank you, Rachel. So as Rachel gave us a good overview of CORE's prior authorization efforts, attachments definitely fits in it's a critical piece of that, as well as supporting additional of the HIPAA mandated transactions. And what CAQH CORE is doing is, although there is no HIPAA standard for electronic attachments, the industry is definitely moving forward towards building approaches to drive adoption towards electronic attachments. And then in relation to an attachment standard, there's upcoming HHS activity identified in the fall 2017 Unified Agenda, which is a semi-annual publication that the federal government releases outlining upcoming regulations for the year. And with the Unified Agenda, it was announced that a proposed rule for an attachment standard and operating rules is expected to be released in the August 2018 timeframe. So in preparation for future operating rule development related to attachments, CORE has remained actively engaged in the attachment space through surveys on current state of implementation, adoption, industry tracking, conducting industry education, and ongoing environmental scans given its designation as the HHS operating rule author. So on the next slide, just kind of to frame kind of the scope of attachments and how it relates to the industry. The 2016 CAQH Index reports that manual attachments cost nearly $6 more to send and receive than a claim attachment. Further, the index finds that only 6% of healthcare claim attachments are submitted to medical health plans electronically using the 275 transaction standard. So as identified by low adoption rates and potential cost savings to the industry, CORE is working on an attachments environmental scan to inform the industry of trends, best practices, and challenges as organizations transition from manual to electronic processes. So in our research and planning phases of our environmental scan have been completed, and where we have surveyed and engaged with a variety of industry efforts related to attachments, from participating in industry work groups, attending conferences, and monitoring regulatory activities. And from those activities, we have developed an interview guide tool to survey key stakeholders on their attachment efforts across key opportunity areas. And some of those include identifying business needs, data content, and infrastructure components of how electronic attachments are being conducted today with various stakeholders. And presently, we are currently in the middle of an environmental scan where we have outreach to over 50+ organizations representing a variety of stakeholders, including providers, health plans, vendors, government agencies, and clearinghouses. And we are in the process of conducting actual interviews with these organizations and on-site visits with interested stakeholders. Our preliminary findings show that most health plans have launched some attachment pilots, or they're either weighing some electronic attachments options. And additionally, initial findings show disparities and non-uniformity in electronic use and adoption of electronic attachments, as many entities are awaiting a mandated standard. If your organization is interested in participating in our environmental scan, feel free to reach out to us. Moving on to the next slide, I'd just like to highlight kind of our potential timeline of our focus on attachment. So through this, moving from current to date to the summer, we are in the process of doing our environmental scan, where we're doing the interviews that I talked about. And then from our findings, we hope to then publish a report, which will then hopefully inform the launch of an advisory group to help really look at the report and help identify a priority and opportunity areas for what CAQH CORE can focus on for potential rules. And then moving into sometime in the winter of 2018 and early 2019, we then hope to launch a subgroup to then really look at those opportunity areas that the advisory group to identify and develop implementable solutions around in the attachment space. And all of this, we're continuing to monitor the status of the NPRM and aligning our work efforts around that. And with that, I will hand the call over to Erin.
Thanks, Taha. That was a great update. And so to piggyback on that, we're interested in hearing from you about your experience with attachments. Please respond here and let us know if you would be interested in participating in the attachments environmental scan, whether to do an interview with our team or perhaps host an onsite. It really helps us learn more to help diagnose where operating rules could have the most impact in driving adoption of electronic transactions in this space. So I think we're not going to show the results of this one, so we'll go ahead and move on to core certification, and I'll hand it back over to Taha.
Thanks, Erin. So, the operating rules help promote seamless electronic sharing of large quantities of administrative data across, the nation's healthcare system, helping in quick, cost-effective, and accurate manners. And widespread adoption of operating rules are critical to ensure these benefits are realized across the industry. So as a way to drive and track market adoption and adherence to operating rules and standards, the core certification program was developed as the industry gold standard to ensure industry compliance and implementation and tracking for operating rules. So to date, CAQH Core has awarded more than 340 core seals across the healthcare industry. Our most recently certified organizations include Santa Clara Family Health Plan, Experian, County of Riverside, and NTT Data. So congratulations to these organizations. And looking at the impact core certification has on our nation's healthcare system and measuring the amount of covered lives that benefit from certification and operating rule implementation, 76% of the commercially insured and 44% of publicly insured lives are covered by a certified health plan for phases 1 and 2, meaning that those individuals should be receiving some of those key benefits, such as the receipt of patient financials upon time of service that help promote the adoption in that way. For phase 3, we see that adoption is growing with 27% of commercially insured lives and 25% of publicly insured lives are covered by certified plans. So what does this data mean? So we see that this is a momentum of certifications in the industry, and that there's increased commitment and collaboration of stakeholders in healthcare to effectively share electronic data in secure and meaningful ways. Moving on to the next slide, many of the reasons why core entities get core certified is based on the idea that there's objective third-party testing, proving whether or not your organization is conforming to the operating rules and standards as the way that they're meant to be. That is being able to get the efficiencies and administrative costs of healthcare. So certification testing and the issuance of a core seal helps give organizations assurance that they comply with federally mandated operating rules and standards, allowing organizations to feel confident in the event of an audit. So it's kind of like using TurboTax or going to a third-party accountant when you file and submit your taxes. It's good practice to find somebody outside of your organization to check your work and make sure you did it right. And core certification is that kind of check for operating rules and standards. Certification helps organizations prepare for potential compliance reviews and audits through its comprehensive certification testing and application process. Core certification is positioned to help organizations assess and validate operating rule and standard implementation, especially in preparation for the HHS Administrative Simplification Program compliance reviews, where instances of non-compliance could result in penalties for $1.5 million. So if you're interested in learning more about the certification program, feel free to reach out to us, and we'd be glad to jump on a call with you.
And to make it even easier for you to reach out to us, all you have to do is respond to this polling question, and our certification team will respond to you. So we'll give you a couple minutes to think about it. Again, if you are an organization that implements these transactions addressed by the operating rules, your product or organization is eligible to be core certified. And as Taha mentioned, it's particularly important now to be able to demonstrate your conformance with the rules, given some of these recent announcements from CMS. So we are happy to support you in that effort. With that, I believe I am now turning it over to Lena Geber-Marian, who is our core senior associate, who leads much of our operating rule maintenance work effort. Lena?
Thanks, Erin. So let's jump into a quick update on our maintenance work, specifically on the core code combinations. The core code combinations were created to establish clear and consistent communications regarding claim payments across stakeholders. CAQH Core published the latest version of the core code combinations on February 1st, which included 82 adjustments based on a compliance-based review. As a reminder to those who don't know, CAQH Core and the Core Code Combinations Task Group conducts two types of review and adjustment. The compliance-based reviews occur 3 times per year and consider updates to the published CARC and WARC lists, while the market-based review occurs once a year and addresses ongoing and evolving industry business needs through an industry-wide open submission period. The 2017 Market-Based Adjustment Industry Survey closed on March 2nd of this year. Those submissions are currently being reviewed by our task group, and the approved adjustments will be included in the next publication of the core code combination, which will be released on June 1st. This update will also include the results of a compliance-based review in response to the March updates to the published code list. I want to take a moment here to take a step back and take a look at what the industry has accomplished over the past several years in regards to core code combinations. The market-based review process was established to ensure that the code combinations were meeting the industry's business needs. That first market-based review that we conducted had almost 450 submissions. This year, CAQH Core only received 25 proposed adjustments. This tells us the core code combinations are meeting the industry's needs and are being consistently used. It's kind of nice. This is one of the few surveys that you conduct that you want almost no responses, because it tells you that you've been doing your job. And so the industry has been able to use the core code combinations successfully. And if you have any questions about the core code combinations or anything else, now is the time to submit them, and I'll hand it back to Erin for more on our Q&A.
Thanks, Lena. We do have some time for Q&A now. I would like to remind everyone to please submit your questions by typing them into the questions panel on your dashboard. And I want to take a minute to thank our speakers again today as well. Our first question comes from a solar practitioner who is curious how they ensure they are receiving the benefits of the core operating rules or benefiting from core in general. And so, Bob, I'm going to ask you about that. How would you describe our work to a solar practitioner and how it impacts their work?
It's a great question. And we've worked diligently with the industry to ensure that providers have the opportunity to kind of reap all the benefits of implementing the operating rules and the HIPAA standards. And through that, we've worked really closely with the industry clearinghouses and software vendors. So if a provider uses for example, a core certified vendor solution or uses a clearinghouse, they should be guaranteed that they're going to receive all of the data that they need through an eligibility inquiry, through a remittance advice transaction, that they may need to actually conduct that transaction fully and automatically. In other ways that we've worked really closely with the health insurance companies. So the companies have dedicated to ensure that their systems can provide that data through those software clearinghouses and software vendors to the provider. So really looking out for the best interest of the provider is kind of our mission and vision. And we work really closely with the health plans, clearinghouses, and software vendors to ensure that their systems and applications have been mitigated, have been changed, have been updated, are available for access for the data and access really through an infrastructure, a nationwide infrastructure at this point, where that data is available. Again, and we're moving through, as Rachel mentioned, on to the next kind of data set for the prior authorization transaction. So we have that kind of data available for eligibility, for the remittance advice transaction, and we're continuing to move the industry forward as we look at other HIPAA transactions where that data is needed by the provider.
Great, thanks, Bob. And I think this is a good follow-up question, and I'm going to pass this one off to Taha. What are the benefits to becoming core certified, and what are the cons of not being core certified?
Sure. So there are several key benefits that we hear from our stakeholders that pursue certification. One of them is, as I mentioned earlier, is assurance of giving that level of confidence and assurance that your IT systems are adhering to operating rules and standards, especially since phases 1, 2, 3 of the rules, the eligibility, claim status, EFT, and ERA are mandated by legislation. So, giving that sense of confidence. Also, there's also value-driven ensuring that trading partners are aligned, and also the potential cost savings for implementing operating rules are some of those key benefits. And then some of the, I guess, on the flip side is that not achieving certification, you don't have, especially with the potential compliance reviews, is that you're self-attesting and self-validating all your aspects. So being sure that all your documentation is in check, and that you're prepared for in the event of an audit or in the event of a complaint, that you have all your documents in check. So certification is able to then provide that outside verification and validation that your organizations are compliant. We do comprehensive reviews, there's certification testing to ensure your systems are complying with the rules that are required, especially for phases 1 through 3. And also for phase 4, ensuring that your systems are ready, and that leveraging some of the past infrastructure to build off the past phases.
Great, thanks, Taha. And this is a question, Bob, I'm going to send this one back to you. What's the difference between core participation and core certification? And how might I find out if my organization is one or the other?
Oh, great question. Core participants, we do maintain a list, actually for both, for a list of all the core participants, it's available for free on our website, as well as a list of all the entities, again, those main 4 stakeholder categories: health plans, clearinghouses, software vendors, and providers that have taken that extra step to become voluntarily core certified. So both lists are available on our website. A great distinction here is that as a core participant, those 130 entities that are core participants, they are ponying up resources, folks that join our calls and our efforts. They send subject matter experts onto those calls. And as we develop and review information and data from our analysis, from our environmental scans, from feedback forms that we've received, all the different means and ways that we have of surveying the industry and analyzing that data, those participants, again, sit at that round table and help make decisions. They make decisions on where specific rule requirements what those requirements should be. How do we test and certify a piece of software that now must supply this type of data because that's the new requirement? So those discussions are had, those decisions are made by the core participants. And then those participants roll out that set of operating rules. So the new set for, for the latest phase 4 with the requirements for infrastructure, for claims and prior authorization. Now the rest of the industry, it's on them to go and implement those operating rule requirements. And so those entities that have gone through voluntary core certification, they've taken that challenge. They've completed that extra step that Taha talked to us about. I'm going through that certification process, sending transactions by the ones to ensure that you're sending the data, that you're receiving the data, that you're passing the data on, that it's made available to the providers. And you're doing that in a way that is consistent with the infrastructure requirements. So that's kind of how you go from participating in developing to becoming a voluntarily core certified entity, because you've taken that challenge that the core participants have made to the industry.
Great, thanks, Bob. And this next question is about prior authorization. So I'm going to send it over to Rachel. And the question is, when do you anticipate a prior authorization operating rule to be available for implementation?
Sure. So actually the phase 4 prior auth rule is already available for implementation, and I invite you to go on our website to take a look at that. And the next phase of rules related to prior authorization are in development now, And after all of the approval processes and all of the due diligence and feedback for that, we're looking at an implementation date of about a year from now.
Great. Thanks, Rachel. Bob, another question for you. Someone is curious about how CAQH and WEDI work together. And I know Rachel talked a little bit about that when she talked about the prior authorization work, but can you talk about that a little more broadly?
Yep, great. As Rachel mentioned, we do work really closely together on the PA project that we have, as well as many of our projects. We attend WEDI. WEDI also has representatives at CAQH core. We work really closely on very specific topics. We have membership on the WEDI board, for example, as well. We'll be presenting at WEDI in a couple of weeks in 3 different sessions, sharing the status of where we're at in many of our projects in much more detailed fashion with the technical folks at WEDI. So it's a great symbiotic relationship. We help educate the industry together. We work closely together with many of the same resources.
Great. Thanks, Bob. Next question is for Taha. What does an organization have to do to be core certified? What's the process?
Sure. So core certification is available to implementers of the transaction. So you have to be either currently using or transmitting the transaction, first of all. And then there's a 4-step process for certification. So the first step is analysis and planning. So we have lots of tools and resources available on our website that will help you identify any sort of system gaps you may have, ensure that you're conforming to operating rule requirements, and ensuring that if you need to work with external organizations or trading partners to ensure that there are no gaps in your system before you move on to the next step. So then the second step would be actually signing what's called the core pledge, and the core pledge is essentially a document that indicates your commitment to core certification and completion of certification testing within 180 days. And after the core pledge is signed, then we can get you started with the third step, which is certification testing. And this is working with our third-party testing vendor to go through the actual testing requirements by each of the operating rule requirements. So, testing the data content, the connectivity of your transactions is showing that you're actually sending acknowledgement. So going through each of the rule requirements and actually conducting step-by-step testing. And after your testing is completed, the last step is actually submitting the core application. So this is an application and payment with it to communicate that your organization has completed testing and that you would want to then apply for the formal core seal. And definitely can follow up with you after the call to kind of get more detailed into the process.
Great. I think we have time for one more question today. And the question asks if the core research on attachments is available yet. And the answer to that is no, the research is still ongoing, but we do have some great resources on attachments available on our website. Over the past year, we have done a 4-part webinar series on attachments, talking in detail about the technical components of attachments, where the industry is in terms of adoption, and those are all available on our website. And so I would encourage folks interested in learning more about the attachments topics to start there. So I think that's all the time that we have for today. I would like to thank everyone for joining us and your continued interest in our mission to streamline the business of healthcare. I think today was actually our highest registration for Town Hall in almost 5 years. So we really appreciate you all making the time for this session today. I just want to share a brief reminder of our upcoming conference presentations and webinars before we close. If you're attending the WEDI conference in a few weeks, we look forward to seeing you there. Additionally, we have the interoperability webinar coming up as well. Feel free to email us at core@caqh.org if you would like more information on operating rules or any of our other activities. Additionally, we welcome your feedback and on both our processes and today's session. Have a great rest of your day. Thanks so much.